Do you know what the third most common type of cancer in the world is? It's colon cancer, and it's on the rise globally. Colon cancer is one of the most common cancers, but most people don't know that. And that's why we're here. Our channel will cover a wide range of topics related to colon cancer and how individuals can determine if they may be at risk. We'll also discuss factors that can increase the likelihood of developing colon cancer and strategies for preventing it. Our channel aims to provide a comprehensive understanding of colon cancer, from its causes and diagnosis to its prevention and treatment, in order to promote awareness and informed decision-making regarding this common disease. Colorectal cancer is a common type of cancer worldwide. It affects the colon and rectum, two organs that can be difficult to distinguish from each other. Each year, more than 1.8 million people worldwide are diagnosed with colorectal cancer, with colon cancer specifically affecting over 1.2 million people. This highlights the significance of this disease and the importance of awareness, prevention, and early detection. You can help protect yourself from this disease by making sure your doctor screens you regularly for signs of colorectal cancer. If you notice any unusual changes in your bowel habits or bowel movements that are causing you concern, go see your doctor right away. Rectal cancer is becoming increasingly prevalent in some countries. It's a major health concern for both men and women, with statistics showing that 1 in 23 men and 1 in 25 women will develop this disease. In some regions, such as Latin American countries like Uruguay and Argentina, colon cancer rates are similar to those seen in the United States and Canada. The colon is a vital organ responsible for absorbing nutrients and water while also serving as an essential part of the immune system and the colon-brain communication network. Given its importance, understanding the risks and preventative measures for colon cancer is crucial. The colon is a tube that moves the food bolus through the body. The ascending, transverse, and descending colon transport it from right to left before connecting with the rectum and anus. As the colon breaks down food, it converts them into essential nutrients like proteins, amino acids, minerals, vitamins, and carbohydrates that are then transported to the blood. The colon is a second brain because it collects information from the environment in our body and communicates with the brain. The brain then sends information back to the colon, which then relays it back to us. This means that we can communicate with our colon directly. We don't have to rely on language or writing for communication between us. The colon is an important part of maintaining good health because it breaks down food into nutrients that are then transported throughout your body. When there's degeneration of cells in this part of your body, or if you have any other medical problems, it can lead to development of cancerous tumors called colorectal cancers. This means that maintaining a healthy regimen of exercise and diet are vital to protecting yourself against these types of malignancies. Colon cancer is a serious disease that begins with the degeneration of colon cells and ends with the development of malignant tumors. Colon cancer develops when normal cells in our body begin to mutate their DNA and turn into cancerous cells. This process is governed by our genes, which are contained in our DNA. DNA mutations cause colon cells to undergo changes in their DNA sequences and become malignant, leading to colon cancer. While other mechanisms of cancer production remain unclear, preventing DNA mutations in colon cells is crucial for maintaining colon health. Any inflammation of the colon should be treated immediately to avoid these mutations. O câncer de colon é causado por mudanças no DNA das células que as fazem crescer descontroladamente. Your risk of developing colon cancer increases with age, especially after age 50. African Americans have an increased risk of developing colon cancer compared to whites. Additionally, individuals with a personal history of colon or polyps in their colon are at increased risk of developing colon cancer. Inflammatory conditions such as ulcerative colitis, Crohn's disease, or other types of colitis can also increase your risk of developing colon cancer. Inherited syndromes at the colon level such as Lynch syndrome or familial adenomatous polyposis also increase your risks for developing colon cancer and require regular medical attention. Risk factors for colon cancer include family history, high fiber or fat diet, lack of exercise, diabetes, colon inflammation, overweight, tobacco and alcohol use, radiation exposure, and low physical activity. The risk of colon cancer is on the rise, and there are a number of risk factors we can control to help prevent it. However, many of these risk factors are not modifiable. We can modify others by changing our diet, habits, and exercising regularly. Persistent changes in intestinal habits may be a sign or symptom of colon cancer. If we notice irregular bowel movements such as constipation, diarrhea, or changes in stool consistency that persist over time, we should consult a doctor. These changes should not be overlooked because they may be the first warning signs of colon cancer. It is important to pay attention to any changes in stool consistency as well as any other signs or symptoms. Next, rectal bleeding, the presence of red blood in the feces, indicates an ongoing inflammatory process in the colon or rectum. Therefore, noticing blood in the fecal matter, abdominal discomfort, bloating, feeling full, experiencing cramps in the abdomen, frequent gas and increasing pain in the ascending, transverse or descending colon can indicate an inflammatory process which may include colon cancer. Even if it is not cancer, it may be inflammation of the colon that requires treatment. Feeling weak and experiencing unexplained weight loss are also symptoms that can accompany colon cancer. Therefore, if you frequently experience these symptoms, it is important not to delay a medical consultation, as this could be a sign of inflammation of the colon which needs to be treated to prevent it from developing into colon cancer. Colon cancer can be detected early through the signs and symptoms we have discussed, as well as periodic screening tests, especially for those with more risk factors. By undergoing periodic evaluations, we can detect polyps in the colon and remove them before they develop into cancer. Other tests are also available, such as the detection of occult blood or fecal cortisone, which may indicate bleeding in the colon. An immunochemical stool test and DNA test in stools can also help detect early stages of cancer or changes in DNA-influenced cells in the colon. It is important to take advantage of these screening tests, particularly for those at higher risk, to increase the chances of early detection and treatment. A colonoscopy involves inserting a tube through the anus to examine the entire colon, take biopsies, and identify early signs of colon cancer. A rectosigmoidoscopy typically precedes this exam. It evaluates the rectum and sigmoid before the colon begins. If detected in time, colon cancer can be eliminated from a person's life through surgery, where the cancerous part of the colon is removed. This is called radical nephrectomy, and people can lead a normal life again. Chemotherapy may also be needed if the cancer has metastasized to other parts of the body. Advances in cancer treatment have improved survival rates and overall quality of life for people with colon cancer. To detect colon cancer early, we should be vigilant of the signs and symptoms we have discussed earlier, and also undergo periodic screening tests, especially for those with multiple risk factors. Polyps can be detected early and removed from the colon to prevent them from turning into cancer. Tests like occult blood and immunochemical stool tests can help identify early stages of colon cancer. Furthermore, colonoscopy and rectosigmoidoscopy are essential exams that can detect colon cancer and take biopsies for further analysis. If colon cancer is detected early on, it can be treated and eradicated. However, if left untreated, it will progress to metastasize and cause death within a few years' time frame. Therefore, early detection is crucial. To prevent colon cancer, fiber is found in fruits, vegetables, grains, seeds and nuts. Consumption of fiber-rich foods can reduce the risk of colon cancer by reducing the amount of harmful substances that enter the body through the digestive tract. These substances include carcinogens and toxins such as pesticides, heavy metals and other chemicals. A high-fiber diet may also help improve heart health by reducing inflammation in the body caused by atherosclerosis. It can also help prevent diabetes and reduce circulatory disorders such as high blood pressure. In addition, following an anti-inflammatory diet can reduce the likelihood of chronic colon infections or inflammations. Avoiding smoking and alcohol consumption is also critical in preventing any type of cancer, particularly colon cancer. If you're concerned about your risk for colon cancer, consult your doctor to determine if daily low-dose aspirin is a suitable preventive measure for you. However, aspirin is not recommended for everyone, and your doctor should evaluate your individual risk factors before recommending this treatment. It is my hope that this information has raised awareness about colon cancer, which is the third most prevalent cancer worldwide. Colon cancer is a very common disease that affects both men and women. 1 out of every 5 men, and 1 out of every 4 women, will develop colon cancer, so it's important to take steps to prevent it. If you found this information helpful, please like this video and subscribe to our channel so that we can continue to share health-related information with you. Additionally, if you're interested in learning how to take better care of yourself, feel free to become an exclusive member of our channel by searching for the word "Join" on YouTube. Personally, I take care of myself by maintaining a healthy diet, exercising regularly, avoiding alcohol and smoking, and adopting a balanced lifestyle to reduce my risk of colon cancer. Let us all work together to promote good health and prevent colon cancer. It's crucial to openly discuss diseases, not to cause panic or fear, but to raise awareness and encourage testing. We can all support and take care of each other as a community. Let's work together to address the challenges we face, including the climate change crisis. Thank you for watching, and see you in the next video.